Have you ever wondered how your ribs move when you breathe, or which muscles are actually responsible for expanding your chest? In this video, we will break down the muscles of thoracic wall in the simplest way possible so you can fully understand them, remember them, and apply them in exam. The thoracic wall is not just a rigid cage, it's a dynamic structure made out of muscle that have aim, breathing, and stability. Several muscles from the upper limbs, abdomen, neck, and back attached to the thoracic cage. So, let's start with the muscle connecting the upper limbs to the thoracic cage. These muscles are pectoralis major, Pectoralis minor, serrated anterior, which present at anterior part of the thoracic cage, and Latissimus dorsi, mainly present in the posterior part of the thoracic cage. These muscles mainly move the upper limbs, but they can also assist in breathing. These are accessory muscles of respiration. During deep or forceful breathing, some muscles act as accessory muscles. Pectoralis major and pectoralis minor, and lower part of the serrated anterior muscle, and scaling muscle, anterior scaling, middle scaling, and posterior scaling muscle. These muscles stabilize or elevate the upper ribs, or allowing the lower ribs to expand more effectively. The main muscles of respiration are intercostal muscle. Each intercostal space contains three layers of intercostal muscle: external intercostal muscle, internal intercostal muscle, and innermost intercostal muscle. External intercostal muscles are directed downwards and forward. Their function is to elevate the ribs during inspiration. Internal intercostal muscles have different direction with external intercostal muscle. They directed downwards and backward function. Internal intercostal muscle has two functions. In the osseous bed, depress the rib, so involved in expiration, and interchondral bed, elevate the ribs, so involved in inspiration. And the innermost muscle is the innermost intercostal muscle. This muscle function is similar to internal intercostal muscle, and they are located laterally. If you want to find the innermost intercostal muscle in your chest wall, you can find at the lateral side of the chest wall. External intercostal muscles become external intercostal membrane anteriorly, and internal intercostal muscle become internal intercostal membrane posteriorly. And then let's look at the deeper muscle. These muscles are transversus thoracis. They are attached from the sternum to costal cartilage or second to sixth rib. Their function is weak rib depression, so they involve in expiration. And these are subcostal muscle. Their function is similar to internal intercostal muscle. They span 2 to 3 ribs. And another muscle is Levatores costarum. These muscles attach from transverse process of thoracic vertebrae to the ribs. Function, elevation of the ribs, so involved in inspiration. And then serratus posterior superior, which elevate the ribs, involved in inspiration, and serratus posterior inferior, depress the rib, involved in expiration. So above these muscles, all these muscles work together during respiration. Inspiration, rib elevate, thoracic cavity expand. Expiration, rib depress, thoracic cavity reduce. So these muscles, intercostal muscles, are prevent bulging outward during expiration and collapse inward during inspiration. Even though we know the general action, the exact role of each intercostal muscle is still complex and still studied using electromyography. And these are my references. So now you have got a complete understanding of thoracic wall muscle from structure to function and breathing mechanic. If this helped you, don't forget to like, share, and subscribe for more anatomy made simple. Thank you very much.